My name is Ugo Uche. I am a therapist based in Tucson, Arizona, and I am also the owner of Road to Resolutions. In this video, I am going to be discussing the fundamentals of cognitive behavior therapy. When I describe myself as a cognitive behavior therapist, oftentimes people, inquire to know what are the specifics of the discipline, and in this brief video, I will explain it. So I'm going to start by just writing cognitive behavior therapy. So the fundamental goal in cognitive behavioral therapy is getting people to change unwanted behaviors that have become habitual and have become problematic. It just causes more trouble than it's worth in their lives. And so the process of changing unwanted behaviors is understanding what triggers these behaviors. So I'm going to write experience, so our behaviors are usually in response to experiences that we witness, that engulf our lives. And our behavior response to experiences can be subtle, can be overt, somewhere in between. So you have your experience and you have your behavioral response. And then you have your natural and logical consequence. It's important to note that your experience can either be a conflict with someone. It can be you finding yourself in a depressed mood. It can be you feeling chronically anxious, or just experiencing chronic stress. Your experience can be any of these things, but for the purpose of this demonstration or this explanation, if you rather, we're going to be focused on behavioral responses that are problematic. So I'll use an anger management scenario. So let's say your experience is somebody you felt disrespected or humiliated by someone's actions towards you. Your behavioral response was to engage in retaliation, and you overreacted in some way, shape, or form. Natural and logical consequences do not go your way. You get in trouble with the law, something of the sort. And you look back and you recognize that this is a pattern in your life, that you have this overreaction to events where you perceived you were being disrespected, humiliated, and things of the sort. So you come to see a cognitive behavior therapist, and you and the cognitive behavior therapist agree that your behavioral response of overreacting or retaliating is problematic and needs to be changed. And it needs to be changed to a behavioral response that's dignifying. So you're not cowering down. You're not being pathetic. That's dignifying but effective in resolving whatever the problem may be. Now, it's also important to note that a lot of people in error will conclude that their experiences leads to unwanted consequences. But the deciding factor or the influencing factor is how they respond to their experiences. So, with a cognitive behavior therapist, the first thing you and your therapist will do is you guys will discuss your feelings. Actually, this arrow is supposed to be pointing up. Your feelings influences your behavioral responses. Now, the important thing to understand about feelings is that all feelings are good, whether it's a positive or a negative. So you have true positives, false positives, true negatives, false negatives. But the purpose of your feelings are to communicate messages to you. And so one of the first things you and your therapist are going to do is you're going to learn cognitive behavioral strategies, and you're going to practice these strategies in recognizing your difficult feelings for what they are, getting past them, and engaging in appropriate behavior to the consequence, in response to the experience, which will influence the consequence to be more manageable. And so, in the process, after you've gotten into the habit of doing that, you're still influenced by ideas you adopted in your early life experiences regarding how you respond to these experiences. It's important to note that most of the ideas, I'm going to substitute ideas with core beliefs. Most of the core beliefs we had regarding how we respond to our daily experiences and novel experiences are already predetermined. For example, with the anger management scenario, from a very young age, if you're dealing with somebody who was bullied, they probably came to the conclusion that they would never ever put up with anybody disrespecting them or humiliating them in any way, shape, or form. Now, it may be a small child can get away with this to a certain degree, but it's much difficult for an adult to get away with this in a civilized society of any kind. So, after you have developed a consistency in being able to get past your difficult feelings, you and your therapist are now going to start talking about your perceptions. And subsequently, your core beliefs. Your perceptions are based on how you perceive your experiences, which influences your feelings, which influences your behavioral response. And your perceptions come from your core beliefs. So if you look at your core beliefs as a big pie, your perceptions are a slice of the pie pertaining to that specific experience, which influences your belief, your feelings, and influences your behavioral response. Now, this is the most important part of the therapeutic process, in that you're going to start doing a lot of early life experiences in understanding under what circumstances did you develop these core beliefs and subsequent perceptions. Most of our core beliefs are contradictory. So a lot of things we say we believe, we don't really. We just adopted them later in life. But our true beliefs are beliefs we adopted between the ages of 2 and 6, mostly before the age of 12. And they become subconscious. We have forgotten about them, even though we act on them on a daily basis. So if you say somebody who has poor anger management, who has a history of responding with violence to perceived disrespect or humiliation, you say to them, hey, do you believe in violence? They'll say, no, I'm a very peaceful person, etc., etc. So what you have is a contradiction of beliefs in which they have a track record of responding with violence to perceived disrespect, but they in their hearts they're not intentionally lying when they say they don't believe in violence, until you point out the discrepancy. So this is how a lot of our beliefs can be contradictory. So how do you know what your core beliefs are? Well, look at your behaviors, look at your patterns of responding to stressful situations. Specifically, look at your patterns of responding to unwanted feelings or difficult feelings, and that will tell you what it is that you truly believe. Now, a lot of these are premeditated. We learn them when we are very little. We've forgotten the circumstances we learned them, but by piecing together bits and pieces of family history you can get a good idea how and why you adopted these beliefs, and when these beliefs expired, into your adulthood. So the solution now that you already have a track record of not overreacting to your difficult feelings, getting past your difficult feelings, and attending to the problem from a logical mindset, now you can practice adopting healthier healthier beliefs that are consistent in dignifying you, and based on practicing cognitive flexibility and adaptation to situations that are out of your control. And so, in a nutshell, this is cognitive behavioral therapy. You start learning how to get past your difficult feelings, and then you go deeper. You address your core beliefs, and you substitute unhealthy beliefs for healthier beliefs. And there are exercises for you to practice healthier beliefs while you're also practicing and reinforcing your new learned habits of not overreacting to difficult feelings. And that's all for now. I thank you for watching this video. If you're watching this on YouTube, all comments are welcome in the comment section. If you like this video, please give it a thumbs up, and I would appreciate it if you share this with as many people as possible. And if you are watching this on my website and you have more questions about my services, go ahead and leave your information in the contact box, and I will be in touch with you. Other than that, have a nice day, and thank you for watching.